Have you received your COVID-19 vaccine? And if you have not received the vaccine, do you think you should get vaccinated? And would you consider getting vaccinated? I'm going to present some information and let you decide on the way forward. But hopefully you will decide to get vaccinated if you haven't been vaccinated. Hi, I'm Dr. Mo. I am your pharmacist, and on this channel, I release weekly educational videos about your medications. I talk about health tips and smart tips to keep you healthy. These videos are for educational purposes only. They are not meant to replace your healthcare provider's advice or recommendations. All right, so let's get into the video. It has been over a year and a half since the COVID-19 pandemic hit the world, and the world has never been the same. We're still yet to recover. Till the day when 2021, COVID-19 started back in 2020, there have been over 200 million cases reported worldwide. And of the 200 million cases, there have been a minimum of 4 million deaths. Yes, I need to stop and think about that. 4 million deaths. And unfortunately, we're still counting. So what is the way forward? And I say 4 million deaths because not all the deaths that were related to COVID were reported as being COVID related. So what is the way forward? What do we do? Currently, there are 3 vaccines for the coronavirus: the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. And according to the Centers for Disease Prevention and Control, the CDC, the best form of prevention or protection against the coronavirus is full vaccination. Full vaccination means that if you get either the Moderna or Pfizer vaccines, you will get it in 2 doses, spaced 3 to 4 weeks apart. If you get the Johnson & Johnson vaccine, you get a single shot and then you're done with it. So the Pfizer and Moderna vaccines are messenger RNA vaccines, which means that they have a similar mechanism of action. This means that you take them in 2 doses spaced 3 to 4 weeks apart. So assuming you get your first dose in mid-January, 3 to 4 weeks later, put you in February, you get your second dose in February. After 2 weeks of getting the second dose, you're considered fully vaccinated because it takes the body about 2 weeks to mount up immunity to the vaccine. Some common side effects of the Pfizer and Moderna vaccine would be injection site reaction, whereby at the site or the arm where you get the vaccine, you might experience some pain, some redness, some swelling. You might even experience some discomfort when you try to lift up the arm because of muscle pains or joint aches. That is normal. You might also experience headaches, pain, fever. Again, all this are normal and should go away within a day or a couple of days. You could also take some Tylenol or ibuprofen if the symptoms are bothersome. The Pfizer vaccine was fully approved August 2021, which means that now it has full approval and it's approved for anyone age 12 and older. The Moderna and Johnson & Johnson vaccine don't have full approval yet, but you could still get them. It just means that they are in line waiting for FDA approval. If you get either the Pfizer or the Moderna vaccine, it's a great idea for you to get a booster shot. And when do you get the booster shot? I'm glad you asked. You get the booster shot 8 months after you receive the second dose of either the Pfizer or Moderna vaccine. So remember I said we assume that you get the first dose of the Pfizer or Moderna vaccine in January. You get your second dose in February. You get the booster shot in October. 8 months after February puts you in October. However, if you have any kind of underlying conditions, if you have cancer, you have a lower immune system, you take medications that suppress the immune system, you probably would be able to get the booster shot way before the recommended 8-month time frame. So a serious side effect of the Moderna and Pfizer vaccine is something called myocarditis or pericarditis, which is basically inflammation of the heart muscles. If you experience any kind of shortness shortness of breath, any kind of difficulty breathing after you get either the Pfizer or Moderna vaccine, you may want to go to the hospital or have somebody drive you to the hospital. It is a rare side effect, but it is serious, and it occurs more often in men than women, men aged between 12 to 24. So for the Johnson & Johnson vaccine, the only single shot vaccine that we currently have in the United States, you take it as a single dose, that's it, it's done. And again, 2 weeks after you take the shot, you are considered fully vaccinated. Some side effects, again, that you may experience are similar to some of the ones that you get from the Pfizer or Moderna vaccine, which could be injection site reaction again, pain, swelling, difficulties when you raise up the arm. You might get some nausea, some fever, some fatigue, some tiredness. All this are normal. If you get this, they should subside within a couple of days. A serious side effect, or two serious side effects of the Johnson & Johnson vaccine would be something called Guillain-Barre Syndrome, which is also known as GBS. It's an abbreviated form. And it is characterized by tingling and weakness. Another side effect is blood clots, which is more common in women than in men. If you experience any kind of tingling, any kind of blood clotting, you definitely want to go to the hospital. These two side effects are very rare, but they do occur. And the Johnson & Johnson vaccine, it is a modified form of the coronavirus. So if you ask me, why should I take the COVID-19 vaccine? I'm glad you asked. Remember, I stated earlier on that there have been a minimum of 4 million deaths reported worldwide. So it is your responsibility and my responsibility to make sure that we keep the death rates low or where they are, and the only way we're able to do this is by getting fully vaccinated. The benefits of getting vaccinated with the COVID vaccine far outweighs the risk. The COVID vaccine is safe, the COVID vaccine is effective. And currently, there are no recommendations to get a booster shot of the Johnson & Johnson vaccine. That might change in the future, but as of today, there are no recommendations for a booster shot. Another reason to get the COVID vaccine is because employers are now requiring proof of vaccination. If you're going to fly out of the country, you're going to board a plane. Previously, a lot of them were requiring proof of a negative COVID-19 test result. Right now, most of them are asking for proof of a negative COVID-19 test. They're also asking for proof of vaccination. In the state of New York, if you're going to dine in a restaurant, you have to show proof of vaccination. If you're a sports fan and you love to watch sports and you want to go watch a game, a live game, most of them are now requiring that you show proof of vaccination. If you're a federal worker, if you're a federal contractor, most of them are now requiring you show proof of vaccination. Most colleges, most universities now are requiring that their professors, their students also show proof of vaccination. So I think it might be a matter of time before everyone starts to require that we show proof of vaccination. And if you are not vaccinated or you don't want to get vaccinated, I know some employers right now are making concessions whereby you're able to still work so long as you provide proof of a negative COVID test result every so often. You still have to follow the normal COVID-19 protocols of regular hand washing, wearing your face mask, observing the social distance protocols. How long are they going to do this for? I don't know. A lot of people have already lost their livelihood. A lot of people have already lost their jobs. Is that fair? No. But I'm wondering, how long are they going to continue to do this? Is it going to be long term, or are they just going to say, okay, you know what, it's a blanket thing whereby if you don't want to get vaccinated, that's fine? Or are they going to mandate? I am strongly thinking that over the course of time, everyone might be requiring us to get vaccinated. So the earlier you get vaccinated, the better. So I encourage you, do not sit on the fence, because too many people have lost their lives for us to be complacent, for us to fold our hands. Too many people have died for us to say we're not going to be proactive. So I encourage you to get the vaccine, and make sure everybody around you gets the vaccine. Your loved ones, your friends, your neighbors, make sure you tell them to get the vaccine. So some people died while they were waiting to get the vaccine. Unfortunately, the vaccine did not come out before they died. So please do not sit on the fence. Consider getting the vaccine. Remind, tell everyone about you. Ask them if they have received the COVID vaccine, for the love of humanity, for the love of all those who have died, for the love of all those who have lost loved ones, who have lost parents, spouses, children. Do it for them, and don't sit on the fence. If you're new to this channel, don't forget to hit that subscribe button and turn on the notification bell, so whenever I release new videos, you will receive the notification. Don't forget to like this video and share. Until next time, stay healthy.